Hey everyone, welcome to PHAMCAST. I'm Margaret Wallace-Duffy, the visionary and founder of Preventative Health Awareness Month and Movement. And I gotta tell you, I'm so excited because today I have someone in studio with me, not just one guest, but two, but the first guest that I'm about to introduce to you, I have known for a very long time. She is a good friend, a colleague, and I'm super excited to have her in studio with me today. But we've got a really cool show coming up for you, all about fascia stretch therapy, the role it plays in integrative health, and the importance it plays in putting in your preventative health toolbox. So, without further ado, I'd love to introduce you to my friend and colleague, Leslie Spicer. Leslie is not only a dear friend, but also a dedicated and passionate inaugural FAMBassador. She's the owner and founder of Balanced Body Studio, where she blends her extensive knowledge and experience to create a holistic approach to health and wellness. With degrees in kinesiology and physical and health education, as well as an impressive array of certifications ranging from level 4 fascia stretch specialist, bone fit certified to precision nutrition coach, Leslie brings a unique combination of expertise to her practice. Her commitment to healing is unparalleled, and her holistic approach ensures that her clients experience long-lasting physical, mental, and emotional results. No one else in the area has this rare combination of qualities and qualifications, which is why Leslie is so well positioned to help people achieve their best, healthiest selves. Join me as we dive into this with this inspiring conversation with Leslie and my next guest as well that's joining us, who I've been introduced to by Leslie, and her name is Laura Flaherty. And an incredible U.S. FAMBassador. It's so important that this movement is moving across the border. Laura, who lives just outside of St. Paul, Minneapolis, has been a physician assistant in orthopedics since 1992. Her journey into fascia stretch therapy, or otherwise known as FST, began in 2010 when she sought after stretching techniques to improve her own well-being. From the moment she experienced her first stretch session, she was hooked, completing her level 1 FST course in 2012 and advancing to become a level 4 sports specialist today. For Laura, FST has been nothing short of transformative. She shares this method based in scientific practice, provides pain reduction, increased mobility, and long-lasting feeling of healing for hard-working bodies. She is deeply grateful for FST and the founders, Anne and Chris, whose fearless dedication to sharing their knowledge, experience, and love for this practice has changed countless lives, including Laura's. Welcome to the show, Laura and Leslie.
Thank you.
How are you?
Wonderful. I'm great. I need to also tell you guys that my practice is based in a suburb of St. Paul, and the town is called Little Canada.
Oh,
so there you go. Right.
Awesome.
Even
I didn't
more.
even know that.
I'm so aligned with you guys in so many ways, and
That's great.
so proud to be, as we call ourselves, La Petite Canadienne.
Oh my goodness, we did not know that.
I didn't know that.
Either.
I didn't know that.
You know what? That makes me so happy. And you know, having FAMBassadors south of the border, we truly are excited to see this mission moving forward. And these connections are critically important. So thanks for joining us. So Leslie, why don't we start with you, because you're the one that's brought Laura to the table today, and tell us how you met Laura, and then we're going to dive into some of the really cool things that are happening.
Yeah, so I met Laura last year in September, was my level 4 and sport certification. So I had not even a year previous took my level 3, and I just loved it so much. And what they had told us was going to happen at the time was just a level 3 research with the sport component on it. They were going to be dealing with the lower leg and feet, which I'm super passionate about. Sounds funny, but I am.
Yes.
And so I decided to take the course right away. And so that's where Laura and I met, was last year in September. And to our surprise, making a long story short, usually the material that we get through in, the duration of the course we got through in a day, day and a half.
Wow.
So they started to teach us stuff off the syllabus, and they told us, I believe it was day 2 or day 3 in the morning, that guys, this is time. We're ready to make a level 4, and you guys are going to be the first level 4 class. Yeah.
Amazing. And there were a lot of incredible clinicians and people from a wide range in that room. Can you share a little bit about that, just so people understand that people that are taking this fascial stretch therapy, that they're from all different aspects of health?
Yes, so not even just that, just all over the world.
Yes.
So we had people from New Zealand, we had France, we had Germany represented, we had Barbados, we had Jamaica, we had the 4 or 5 of us from Canada. And yes, and then everybody coming from different backgrounds as well. And that's the cool thing about once you start working with a level 3 or level 4 practitioner, all of us have different modalities as well. So they're not just doing fascial stretch, you're integrating, for example, Laura, Pilates, if I believe that's kind of your background, that's kind of how you got into it. Other massage therapists, chiropractors, integrative body movement people, like just a wide range of
I love that.
different healthcare.
I love that. Well, you wouldn't know that the two of you just met recently because you're doing some incredible work together and bringing, this information to the FAM movement, which I really, really appreciate. So Laura, let's talk a little bit about, I said, as a physician assistant, you're doing some really exciting work, and Leslie and I are really pro science, and bringing fascia stretch therapy to the center where people are going to not only know what it is, but it's going to be valued and perhaps covered, we hope, in the future. Tell us a little bit about your journey and what you're doing right now.
Absolutely. I'm also a huge advocate of FST becoming part of an acknowledged modality within health insurance. I think right now in the United States, we're still seen as being an accessory medicine or a complementary medicine. But working in a very science-based Western medicine field, that was one of the things that really drew me to FST, is that it really is based in science, but the way that we really stretch people, it's really given in a very caring, loving way. I've always been impressed that Ann and Chris have said, you really have to wait for the tissue to invite you in. And that's really how we approach, I think, all of FST. It's really about this invitation. We kind of leave ourselves open and wait for that invitation to happen, and it happens consistently. I think my biggest, most exciting thing that happened, though, which I shared with my level 4 class, and for me to say that we're level 4 practitioners is just still, it's really exciting for me. It's just a really big thrill, and it's a big honor.
And if I could just interject before that story, Leslie, you're in a class of one of how many worldwide that have that level of certification?
Currently, there's 22.
Only 22, and we've got 2 of them here on the show today. What an honor. So tell us the story that you shared with your class.
One of my clients, longtime client, he kind of disappeared for a little bit. It happens sometimes with FST clients. People get busy, and in Minnesota, we have a lot of people that are snowbirds. They escape Minnesota for the winter months, so we don't see them for 6 months. Well, he returned to me, but he told me that he'd had a series of pretty significantly serious health issues. He was no longer driving, and he gets his medical care through the Mayo Clinic in Rochester, Minnesota. When he was down for his visit with the Mayo Clinic, they were doing an evaluation of some of his back pain. The neurologist and the PA said to him, we're really wanting to move away from repeated cortisone injections, particularly for people with spine issues in this mild to moderate category. And he said, what we're really recommending is that you see an FST practitioner, fascial stretch therapy. So this is coming from a physician at the Mayo Clinic.
Love it.
And stating these words, and he said, I want you to make sure you find an FST practitioner and the highest level practitioner you could find. Well, my client kind of turned his head the way he does and said to him, yeah, I've already got my stretch lady. I've got that all covered.
I love that.
And so making that connection, I mean, when my client called me and said, yeah, my doctor at Mayo is now recommending that folks move away from the previous modalities of injections and, anti-inflammatories and start to do stretching, FST stretching. And, Chuck was like, he's like, I agreed with the doctor. And I said to him, I have never felt better than after a stretch.
So this is exciting news and really exciting for the future,
Yes.
right? And you know this. You see this in your practice every day. I've seen the results in referring to you for people. Let's talk, because you've both talked about the fact that it's rooted in science. So let's talk a little bit about that. So when the mental and the physical aspect of what stretching will do, can you speak to that a little bit, Laura, so that people understand? Because, not all stretching is created equal. There are different types of stretching. I've certainly, been trained in PNF, and everything has its place. I'm not saying there isn't a place for it all. But FST is very different in a lot of ways. Can you speak to that, those differences in the science behind it?
Absolutely. And the largest thing is that just fascia. I remember reading an article maybe 8 years ago, and the article said fascia, the largest organ nobody knows anything about.
True.
And I think that's really key is that, fascia is an organ. It starts at the top of our head and it ends on the bottom of our feet. Most people really only know about it because they have plantar fasciitis. So that fasciitis is embedded in fascia, correct? And for me, I try to really educate my clients, and I know Leslie does this too, mostly because we're so enamored with what we do and we trust the technique. We know the technique works, but for us, it's about, we can deregulate somebody's nervous system. There are, the fascia connects to our organs. It goes into the joint capsules. It surrounds our body. I mean, our body could still stand erect if all of our skin was removed. I'm sorry, that's a disgusting way of stating it, but our fascia would hold us upright. It is this connective tissue, but it also has a lot to do with, how we view the world. Is our sympathetic or parasympathetic nervous system overly stimulated? That's how we view the world through that goggle. Are we just waiting at all time to throw a punch or to retreat? So a lot of those, how we experience the world, that influences our fascia. For me, being an orthopedic physician assistant and being in the operating room for, I'm sure, decades cumulatively of my career, but I've seen how fascia looks when it is gently taken care of versus just cut through, and how people recover from surgery is significantly tied to what happens with the treatment of the fascia in the operating room.
Thank you for sharing that, because you're right. I mean, people don't get that bird's eye view. You're in a unique position to be able to see that. I certainly remember seeing and touching and feeling fascia for the first time in a cadaver lab many, many years ago. But like you said, even as a massage therapist, fascia wasn't being talked about until about 10 years ago, and it is this new discovery. So it's really important, I think, that people understand, and the way you just described that, and also that from the preventative lens. Isn't that interesting, Leslie? Because talking about surgery, and what if more physicians and surgeons in particular, are hearing this message, so that when they are putting that scalpel through the different layers of skin and fascia and muscle, that they're taking better care, because preventatively that's going to impact the recovery of that person. That's a powerful story.
Absolutely. Yeah.
And I think probably like you've experienced this and Leslie has experienced, when we first were introduced to, working on cadavers, they are almost entirely embalmed, right? And what does that do to the fascia? It kind of glues it down, and you just have this kind of layer of this almost adhesive, right? And you don't really understand it when it has been under the influence of, the embalming chemicals. But, in the human body, it's a spider web or a geodesic dome, and it has that capacity to always be moving and holding and shaping, but also too, tightening and winding down depending on what's happening to trauma in the body.
And saying that because there's the two sides of the equation, right? And the lack, I mean, this is, somebody that's talking every day about the importance of mobility. And fascia plays a huge role in that. Right, Les?
Yeah, absolutely. And I think what sets FST apart is, like you said, the technique. So there are different types of modalities of stretching, but what we learn is it's a gentle approach, right? It's a painless approach. It's not trying to stretch somebody to the nth degree to see how far we can take them. It's actually listening to the tissue. A lot of the times when I'm treating, I close my eyes, so it's more about the feel more than the look.
Right.
And people are shocked sometimes, I'll get, oh, you can go further. And I'm like, no, we're good right here. And then they get off the table and they're just like, whoa.
It's profound, actually, and you're so right. And I think the more skilled you are and the more experience that, like both of you have, when you're in the hands of somebody, I've been on her table, not on yours. I didn't know you were in Little Canada because I might have come. No, but I've been on her table, and you're absolutely right, Leslie. And can you also both speak to, so it's not just the physical, so you get off the table and there's a definite difference in the way you feel, the way you can move, but there's also a profound impact on the emotional impact that you feel, on the way you feel emotionally and mentally.
Yeah. So I think for me, what I see a lot of, first of all, is that, like Laura spoke a little bit about, is that down regulation. So people just all of a sudden, I hear these sighs.
Yes.
And they don't mean to do it. It's just like, and that's when I hear that, it's like I'm almost giving a fist pump, because I'm like, okay, this person's been able to down regulate. They can now really relax, and I can really move.
Yeah, you know what? This is why I love collaboration in integrative health, because Leslie and you and I have referred back and forth with great success for many years. As a massage therapist, I always say the body is a house for our emotions, and I've witnessed firsthand emotional releases, thousands of them over my career. What's really interesting, if I know and I feel someone is holding and I send them for fascial stretch, the collaboration of the work that we do together, emotions are housed in muscle, but it's also housed in joints, in fascia, and sometimes you need that layered approach in order to really get that profound result mentally and physically.
Like the three big ones are stress, anxiety, and depression, and they're held in fascia.
Yes.
So when you can release and the person feels safe, and that's the other piece I want to say is, I think where I get really emotional about it is knowing that when somebody feels safe on the table and they're able to just let go, because I know that's hard. I'm in their space. And for them to feel safe enough to let go and have that emotional release, which happens a lot. And for me personally, that's when I had my emotional release in level 2, I knew this was the therapy for me. I obviously saw the benefits as a personal trainer with the range of motion and the mobility and the better exercising and all that. But when I saw the release that I had and the weight that was lifted off literally my shoulders, because it was the butterfly stretch that did it, I was like, oh, this is magic. There's something to this therapy. And then I was like, okay, I gotta keep doing this.
You're hooked.
Yeah.
Well, Laura, having you join us today in this conversation is really important, and the future of FST is bright, thanks to people like you and Leslie that are doing the work and advocating like you are doing, in the ORs, at the Mayo Clinic. Thank you for your time today, and I hope, will you come back with us and do more of these episodes, because I think we got to have a regular sort of thing happening about fascia stretch therapy, and really starting to show and opening this up to more eyes so that people can take advantage of this incredible therapy.
Absolutely. I would love to join you again, and I agree with you 100%. Yes, you're always welcome to dial into the little Canadian resident here. I'm always happy to join in.
Well, thank you, and we are so thrilled you as a FAMbassador, and of course, stay tuned because we'll be back here on FAMCAST. Thank you, Laura. We'll be back on FAMCAST, back here with Leslie. We're going to be diving more into this incredible therapy. Get stuck in your toolbox. And of course, if you want more information about Laura, you can also visit our blog, and hopefully Laura's going to be contributing content there as well. So stay tuned. We'll be right back here at FAMCAST.